Hi, I'm Kaitlyn Patton. I'm the Occupational Therapist here at LifeLab. I graduated from Eastern Michigan University in 2017 with my master's in Occupational Therapy. Occupational therapy is a form of therapy used to help people of all ages to increase, maintain, or return to their previous level of independence in everyday tasks. For kids, this could be anything from dressing, writing, using utensils to eat, identifying and communicating when they're hungry, washing the dishes, and so much more. I think that occupational therapy at LifeLab Kids is unique because of our willingness to really look outside of the box and work with the entire team collaboratively, including the caregivers. Because of this, there are very few goals that we are not able to address as a team with our students here. The main benefit of occupational therapy is learning to become more independent in your daily life. We help kids to gain the skills they need to be successful in school, in their community, and even at home. We first determine what the underlying deficits are that are impacting their engagement, and we target those areas, as well as teaching the actual skill that they're having difficulty with. We want to make sure that they have all of those tools that they need to be successful to gain a skill as well as maintain a skill before we actually teach it. I think a huge misconception of occupational therapy, especially when you're working with kids, is that we only work with students on fine motor skills and sensory processing. At LifeLab, we really work with our student and their families to determine what's most important and what's most meaningful in their lives. And then we use that to really create our goals. The biggest tip that I have for caregivers is to allow their child to really have the opportunity for independence. Instead of doing a task for them because it might be too hard or too frustrating, encourage the child to complete a small part of that task. So that could be the first step, it could be the last step. It could be the step that you think would be the easiest for them to help with, but then that takes the pressure off the child to complete the task that might be a little bit too challenging while fostering that independence and that want for independence. Then once you really have that step down, you can add one more step at a time until they feel confident to complete the whole thing independently. If you have any questions, feel free to reach out to LifeLab and hopefully we can answer them for you. Thank you.